Good evening, everyone. I'm Sam Wright.
I'm Brian Allen. As Governor Noem continues to tout South Dakota as a great place to call home, a new television ad aims to address a growing workforce shortage here in the state.
And the newest edition of the Freedom Works Here campaign, as you can see on your screen, well, it features Governor Noem dressed as a nurse in an effort to recruit more healthcare workers to South Dakota. It comes as the state is projected to have one of the highest nursing shortages in the country by the year 2030.
Cooper Seamer spoke with healthcare leaders about their needs. He is in studio now with our 6 o'clock top story tonight. Cooper.
Hey, Brian and Sam. 3 of South Dakota's major healthcare providers partnered to help make that advertisement: Avera, Sanford, and Monument. Those health systems, though, have their own recruitment efforts as well to find and employ new nurses. Avera Health has been trying to plan for nursing shortages well before the COVID-19 pandemic began a few years ago. Its talent acquisition operations has been searching near and far to try and bring in the next wave of nurses.
Obviously, we certainly knew that there was going to be a problem with finding enough nurses prior to even COVID coming on board, because we knew baby boomers were going to be retiring very soon. So we were starting to put some strategic plans in place.
That search isn't just for its major hospitals, but trying to find current students or nurses from other states to consider working in a more rural setting where there's a dire need for healthcare services.
Specifically here in Sioux Falls, exponential population growth. But then when you talk about us being a rural health system and one of the largest employers in the state of South Dakota, we really have to look broadly across all of our care continuums.
To meet that demand, the system has been recruiting nurses that are looking for a change in pace from larger centers in other states, while also trying to provide more experience for nursing students here.
We've also worked collaboratively with a couple of our colleges to develop some grant funding in order to expose nursing students more to that rural setting. And what does that really mean to be a nurse in a rural healthcare system?
Once they find those nurses to fill those positions, keeping them will be just as important.
When you've brought a nurse into your environment, when we welcome them to Avera, what are we then doing to keep them here with us? Retention is essential when it comes to being a successful health system.
Now, Avera Health says that this recruitment effort isn't a short-term project. Even if they reach their goal in filling positions in the coming years, there's always going to be the need to bring in even more nurses on the help for long-term.